Hi, this is Erica Walda, and today I will be completing the patient care encounter assignment. I will start by talking about an experience that I personally had. So, I am type 1 diabetic. When I was diagnosed, I actually ended up in DKA, almost in a coma. And a couple things happened. So, of course, going to the emergency room, right? And then being admitted into the ICU. So, with that, when I was formally diagnosed with type 1 diabetes, I had just an emergency care doctor come in and let me know they were talking about my type 1 diabetes, and I was like, wait, I do not have type 1 diabetes. And they were like, oh, well, you definitely do. So they diagnosed me, and it was a pretty casual conversation where they diagnosed me. However, the next day I did have an endocrinologist come in and visit me. And while going through the reading this week, the biggest thing I think that stood out to me was that with like the collaborative care, I think that when the endocrinologist did come in, I think they really could have added a mental health professional, someone who's receiving a new diagnosis. That tends to be pretty stressful on people. So I think that they could have, offered additional insight that the endocrinologist maybe hadn't thought about, or maybe hadn't seen that was part of her specific role. And then I think maybe leaving a referral for mental health as well. I think those should kind of go hand in hand in those scenarios. But I also thought, before I was discharged, no one really came to, talk to me and see like if I had everything that I needed to be, to go home or things of that nature. So one thing that I also thought was maybe social workers. A social worker could have came in and made sure I had everything I needed in order to, afford my prescriptions, or maybe make sure that I have transportation to my next appointment or things of that nature that social workers may be able to assist with a little bit further. So I think maybe having additional roles like that could definitely be beneficial. I do see the benefit in that. In my specific scenario, there was really just the one doctor that would come in. I've never really seen multiple doctors come in unless you are like in the ICU and they're doing their rounds in the morning. And there are typically different types of doctors in that scenario. But I do feel like for diagnosing and things of that nature, I think it would be extremely beneficial to make sure that there are multiple avenues, you know, so that way I think the biggest thing is that my endocrinologist may have not thought like what is this new diagnosis going to do to her current mental health or to her mental health, maybe 6 months down the line. So I do think that adding all of that would be beneficial to that point.